So welcome everybody to our presentation, the important role of accredited exercise physiologists in our health system. I'll just give you a brief introduction to the clinic. So PXP is an EP clinic that was founded 5 years ago by Kyle and Beth, and we are in Heidelberg Heights. My name's Emma, and Chris will also be presenting. A little bit about me. I have started at PXP 3 years ago, and last year I became an accredited exercise physiologist. Before that, I coached for 5 years in athletics and gymnastics before becoming an EP. And I have a special interest in musculoskeletal injuries, chronic pain, and osteoporosis. And I've done a little bit of research as well alongside with NARI a bit about older people and getting them more active into the community.
Awesome. Hi guys, so my name's Chris. I'm also an exercise physiologist at PXP. So I finished my master's in 2020, so I've been working as an exercise physiologist for about 2 years now at PXP, just for about 1.5 years. I'm passionate about mostly musculoskeletal injuries, sports injuries, and different areas of research regarding to metabolic health. So hypertension, type 2 diabetes, non-alcoholic fatty liver disease. And I've been involved with a little bit of research in that area as well. And I'm also pretty active and involved in a lot of exercise and sport myself, and had many personal experiences with injuries myself too, which is part of the reason I'm quite motivated to help others. So that's just a bit about me. So what we're going to do today is we're going to talk about what an accredited exercise physiologist does, and basically help clarify the role of an EP. We understand that it's sort of, a lot of people are not exactly clear. We're quite a new field, a new industry. So we just want to, I guess, inform people about what we do and provide you with some education also about some recent evidence about exercise for treating prevalent conditions, because there's always new emerging evidence coming out. So we like to keep people up to date so they know how we can help. Cool.
Before we jump into the presentation, we were hoping you could answer a couple of questions now. We'll ask these same questions at the end of the presentation. We want to see if those answers may have changed based on what we've presented. So just jot down like a word or brief sentence, whatever comes to mind straight away about the first question, which is, what is the role of an exercise physiologist? And then, when would you refer to an exercise physiologist? And what are some things or conditions that you think we primarily work with?
Cool.
All right, so if you think of any questions throughout the presentation, just pop them in the chat box. We'll have some time for questions at the end.
Awesome. So this is what we're going to go through today. So we're going to go through what the role of an accredited exercise physiologist is, the context of an appointment, so what an appointment with us actually looks like, target pathologies, so who we tend to see, comparisons of exercise to common forms of treatment, fitness versus fatness as a predictor of long-term health, percentage of Australians meeting the physical activity guidelines, and then how to make an appointment with us at PXP.
So what is our role? As exercise physiologists, we don't just make people exercise, we help people understand their condition and provide them with the tools that they require to overcome barriers to exercise and improve their health. How do we do this? We use a number of different tools. One of them is education. We provide a thorough explanation and break down their condition in a way that they can understand. And we also explain their condition or injury and how it's impacting them in their daily life and what can be done to minimize the impact of that condition. We listen. Listening is an integral part of building rapport and trust in health professionals. And therefore, we know that if we build better patient-centered care and communication, it improves the quality of care, and therefore better outcomes for the clients, but then also better outcomes for us as practitioners that are trying to help the clients. We assess, we complete a thorough subjective assessment that informs our objective data collection and clinical decision making. So as a part of our objective data collection, we can complete cardiovascular fitness testing, strength-specific tests, and functional assessments as well. We exercise people. We use evidence-based exercise prescription. It's case-specific, so each individual, it's individualized to them. It's graded, and it takes into account the client and the clinician's priorities. We monitor changes in health status. We can monitor an individual's vitals before, during, and after exercise, and monitor individuals' response to load and change in behavior and attitude towards exercise. Lastly, but importantly, we also collaborate. So we complete comprehensive treatment plans and communicate across disciplines and refer on to additional services when required.
Cool. So what does an appointment with us actually look like? So when someone comes in, the first thing we're trying to determine is, are they safe to exercise? So we do this by establishing whether they're safe to exercise through their subjective history. So we'll go through and ask them about their medical history, and we'll screen for red flags. So we're looking for things like uncontrolled medical conditions, such as like atrial fibrillation or uncontrolled diabetes. And we've even included a section recently about mental health. So screening for serious signs of mental health risks. And we use that information to determine whether they're safe or not to continue. We also look for abnormal symptoms that don't correspond with their current health information. And we look for abnormal findings via objective measures as well, like ECG, blood pressure, heart rate, and SpO2. With the ECG, we use sort of a 2-lead, so it's obviously not as rigorous as what you find elsewhere, but it still gives us some indication and can detect some abnormalities when we do our like cardio testing, and that can inform us as to whether we continue with them or not. So if we decide that we've seen some things that we're a little bit concerned about, we'll decide that it's maybe not safe today to exercise, and we'll get them to have a medical review. So we'll send them off, and we'll send off all the information we've gathered, and then that medical review will hopefully inform us the next time they come in of what precautions or what adjustments they need in terms of their medication for them to be safe to exercise. So once we get everyone safe to exercise, then we determine, are they ready or are they not ready to exercise? And by this, I mean sort of more from a behavioral point of view. So some people might come in and they might be quite fearful of exercise, and they might not actually be that experienced with exercise. There might be a few barriers there. And so if that's the case, then we apply a bit of what Emma was talking about before. So that listening, that motivational interviewing, and that education to sort of listen to what their concerns are and address those barriers. And sometimes in the session, we might not even get them exercising in that first appointment. We might just have a discussion and address some of those barriers, and then we might exercise in the upcoming appointments. But yeah, so we try to get people ready and make them give the decision to them in terms of actually exercising. So we never make anyone exercise if they don't feel ready to. Yeah, and that's sort of the whole process.
So what are the target pathologies that we work with? There are a number of different pathologies that exercise can help to decrease symptom severity, manage the condition, and then also prevent disease development. The green text that we've got on the screen are common presentations that we see at PXP, and then the white shows other conditions that are within our scope of practice, but we see less frequently at PXP. All the conditions here are evidence-based, and evidence supports exercise as a form of therapy, but it's just with varying degrees of effectiveness. So all of these are supported with evidence as part of therapy.
Cool. And this is just 4 conditions from those target pathologies that we see quite often. And this table is just to sort of represent how effective exercise can be versus other standard forms of treatment. So it's not to diminish or sort of compete with other forms, but just to quantify and give an example of how powerful exercise can be for actually treating a certain condition. Because I think some people just have a general sense that exercise can be good, but not that it can target these specific variables that we try to target with medication and other forms of treatment. So for instance, in hypertension, exercise in this 2019 meta-analysis was shown to be equally as effective in reducing systolic blood pressure. And you've got osteoarthritis, so all of these meta-analyses have looked at, have compared the efficacy of these two, and they're all recent meta-analyses, I should say. Osteoarthritis is shown to be superior. Exercise is shown to be better for reducing pain and improving function than non-steroidal anti-inflammatories, corticosteroids, and injections, and opioids. And this is in knee osteoarthritis, specifically in this meta-analysis. Of course, it's going to vary on a case-by-case basis, but just to see that it has such a profound effect even on pain, and we know that we can exercise someone that's in pain and use that as another modality, just gives you guys and us another tool that we can use in that person's therapy. Depression as well, it's shown to be equal in terms of efficacy compared to serotonin reuptake inhibitors and cognitive behavioral therapy. And again, some of these things work better in tandem, but it's good to see that it is still quite as powerful as those modalities. And then you've also got osteoporosis, so shown to be better in increasing bone mineral density and alleviating symptoms than some of the other treatments. But this is with a caveat because it depends on what type of exercise you are doing. It's very determined on what we call osteogenic forms of exercise. So you'll see meta-analyses with Pilates and that sort of, and yoga and those sorts of passive exercises with no change in bone mineral density. But this one looked at resistance training and what's called impact exercise too. So jumping and things like that. And they looked at it in osteoporotic men. So these are people where you'd probably be concerned with fractures and things, but it's shown to be quite safe and actually quite effective in improving bone density. So that's just some promising results of how exercise can help in those conditions. Cool. Now, we just included this slide as well, just to talk about, I guess, one of the key variables that we address with exercise therapy and what is really important for someone's health. So we're always told that, losing weight is really important, and a high BMI brings with it a high risk of cardiovascular disease and other chronic health illnesses. And although that is the case, from these meta-analyses, we found that cardiovascular fitness is much more of a predictor of things like all-cause mortality and cardiovascular risk. So, for example, in this meta-analysis, they looked at obese individuals and they stratified them by their cardiorespiratory fitness, and they found that so if a person was obese, they had a 2-fold risk of cardiovascular disease. However, if you divide them into high fitness and low fitness, the relative risk was 1.1 and 3.1 respectively. So it's hard to put that into context, but basically showing that if you have a high cardiorespiratory fitness and you're obese, your risk is really low. It's 1.1. That's your relative risk. Whereas if you have a low cardiorespiratory fitness, your risk basically triples. So it goes up to 3.1. So that goes to show that cardiorespiratory fitness is a really important variable. And I think that's a key thing relating to what we do at the clinic, because sometimes people really struggle with weight loss and they think, oh, I'm not losing weight loss, so I mustn't be getting healthier. But with this knowledge, and if you guys and others can sort of help to impart this knowledge, it can allow people to feel confident that they are improving their health, even though it might not show on the scales necessarily. Yeah.
So this is a graph from the Australian Bureau of Statistics, and it outlines that in 2020 and to 2021, the number of people in each age group that met the physical activity guidelines. The blue line that's on the graph indicates the percentage of people that actually met the guidelines. So from this data, it's clear that across all age groups, only 25% of people met the physical activity guidelines. These guidelines are really important because it's the amount of exercise that's recommended to prevent chronic lifestyle diseases. So therefore, from this data, 75% of people are at risk of developing chronic disease because of their sedentary lifestyle. So with some people at greater risk, depending on other underlying factors, but just because they're sedentary, it is increasing their risk of chronic lifestyle diseases dramatically. As Chris mentioned earlier, levels of cardiorespiratory fitness also appear to be in a decline as we age. And as a result, from all of this put together, more people need to be physically active. Not many people are meeting the guidelines, but some people don't know where to take that step or how to get started. So that's where we come in. We help people understand what their barriers are and what sort of activity might be right for them. If they really don't like some sort of exercise in particular, it doesn't mean that they can't exercise at all. And I think that's something that we do really well as exercise physiologists, is break down those barriers. So if you have someone who's not sure how to get started, then how to make an appointment with us. So we see a variety of different clients, whether they pay privately or they have private health insurance, or they also can be referred. So they're referred under TAC, work cover, DVA, or Medicare. What's the process of referring to us? Well, if you'd like a client to come to us, let the client know, and they can either make the appointment themselves. We take bookings online, email, or telephone, where our receptionist, Tanya or Adam, will be able to sort them out. The other option is to send a referral or a handover and mention that you'd like us to contact them about booking in. We're not a bulk bill clinic. The reason for that is because we've found that people paying for their health services allows them to take ownership over it a little bit more, and they're more accountable. But there are considerations. So if you are an individual that has a concession card or a senior card, we are able to bulk bill, but it's only for 20 to 30-minute appointments. So initially we book people in generally for an hour, an assessment, and then following that appointment, we will discuss a treatment plan and what's best for them. That could be a one-on-one appointment. That could be a home self-managed exercise program with then checking in regularly, or a group session. So we have run group sessions as well. So now we're going to pop back to the questions that we started with at the start. And if you'd like to just jot down what pops to mind now after going through our presentation, have any of your ideas changed? So what is the role of an exercise physiologist? When would you refer to an exercise physiologist? And what are the main conditions that we work with?
And even if you have other questions as well, feel free to ask those, whether you want to know more specifically about what we said or something we didn't cover in today's presentation. Yeah, feel free to either ask us now or send us an email afterwards as well. So we'll send this link out to everyone, and that will give you the opportunity to maybe ask a question if you want to.
the other thing is we're hoping we'll send out a few questions for you to answer afterwards, so a little survey. So if you could fill that out, that'd be greatly appreciated. We'll also send out the recording as well. So for those people that missed the presentation, or if you know someone that really wants to see it, just contact us and we'll be able to send it out to you.
Great.
Well, if there's no question, thank you for coming.
Yeah, thanks everyone for coming. And yeah, we look forward to speaking to you soon.
Thanks, guys.